At EHA, we present a updated analysis of the HOVON 50 study. And in this study, we treated younger myeloma patients, transplant-eligible myeloma patients, either with vincristine, adriamycine, dexamethasone induction, or with thalidomide, adriamycine, dexamethasone induction. Both arms got a transplant. And then the TET, the thalidomide group, got thalidomide maintenance, and the VAD group got interferon maintenance. And now, with a very long follow-up of approximately 12 years, I believe, by heart, we see that the responses are better in the thalidomide group. We also see that thalidomide in induction and in maintenance improves progression-free survival. And when you adjust for all sorts of covariates, we also see now, with extended follow-up, a overall survival advantage for thalidomide, which was not visible in the first analysis with a shorter follow-up of approximately 5 years. What is important is also that we see a plateau in the thalidomide group of approximately 20% of the patients with a very durable progression-free survival after 10 years. So maybe these patients after transplant are cured. And we are now, it would be interesting to have more information on this group of patients, of course, which ones are going to survive so long versus the ones that die much earlier, to get more knowledge and how we can learn from this in terms of new developments.